Seniors, beware. 9 popular medications that trigger rapid dementia. Senior health tips. Dr. Kent. It is a stark and deeply concerning reality that the very morning pills many individuals, particularly millions of seniors, meticulously take each day, believing them to be beneficial, could in fact be insidiously stealing their most precious memories. Prescribed by trusted doctors with the best intentions to aid health and alleviate suffering, a burgeoning body of recent scientific studies has alarmingly uncovered a terrifying, undeniable connection between some of the most ubiquitously prescribed medications and a rapid, often irreversible acceleration of cognitive decline. We are not delving into the obscure realm of rare or exotic pharmaceuticals here. Rather, these are the very pills that reside in medicine cabinets across America, and indeed worldwide, implicitly trusted by patients and their physicians alike. Yet, compelling research, meticulously published in prestigious major medical journals, unequivocally demonstrates that these commonly used drugs could be dramatically accelerating the onset and progression of dementia at a truly alarming and previously underestimated rate. Consider, for instance, the sobering revelation that one particular class of medications has been shown to increase dementia risk by a staggering 54% in patients who merely used them for a period as brief as 3 years, further corroborating this unsettling trend. Another comprehensive study meticulously tracked over 3,000 seniors for 7 years, ultimately discovering that certain drugs led to measurable, undeniable brain shrinkage, vividly detectable on advanced MRI scans. Perhaps the most profoundly shocking disclosure is that the #1 medication identified on our meticulously compiled list is prescribed to an astonishing average of over 15 million Americans every single year. A groundbreaking study specifically published in the esteemed JAMA Internal Medicine Journal then revealed that this widely used drug dramatically elevates dementia risk within mere months of a patient commencing treatment, a finding so unexpected that the very scientists analyzing the data struggled to believe the implications of what they were witnessing. For those who wish to delve deeper into the scientific underpinnings of these revelations, all referenced research and medical studies are available for review. Let us commence this crucial exploration by examining medications that many individuals, seniors included, may not even remotely consider dangerous, precisely because they are readily available over the counter. First-generation antihistamines, commonly taken for allergies and sleep disturbances. These include familiar compounds such as diphenhydramine and chlorpheniramine, which are active ingredients found in immensely popular allergy remedies and sleep aids that millions of seniors habitually use on a regular, often nightly basis. The fundamental mechanism by which these drugs operate involves blocking histamine receptors throughout the body, a process effective in quelling allergic reactions and inducing a welcome, albeit temporary, state of drowsiness. However, their impact extends far beyond this intended effect, as they simultaneously block a critical neurotransmitter within the brain known as acetylcholine. Acetylcholine is not merely important, it is absolutely indispensable for the intricate processes of memory formation, consolidation, and learning. When this vital neurotransmitter is repeatedly blocked over periods spanning months and even years, the brain is, in essence, systematically prevented from performing one of its most paramount and fundamental functions. A landmark study, also published in JAMA Internal Medicine, meticulously followed 3,434 participants aged 65 and older for an extensive period exceeding 7 years. The researchers unequivocally observed that individuals regularly taking these specific antihistamines exhibited significantly lower brain volumes on subsequent MR scans when compared to their counterparts who abstained from such medications. The hippocampus, that intricately vital region universally recognized as the memory center of the human brain, displayed the most dramatic and alarming degree of shrinkage. Even more profoundly concerning were the observed cognitive deficits. Participants on these medications consistently scored worse on a battery of cognitive tests designed to measure critical functions such as memory recall, complex problem-solving abilities, and executive planning skills. The study's calculations were stark, concluding that regular consumption of these drugs was equivalent to precipitously aging one's brain by an additional 2 to 3 years, a startling acceleration of cognitive decline that can significantly impact a senior's quality of life and independence. Tragically, many seniors ingest these medications every single night, seeking temporary respite from sleeplessness, utterly unaware that they are, in effect, trading fleeting rest for a profound and enduring detriment to their long-term cognitive health. Moreover, the observed effects are unequivocally dose-dependent, meaning that both the quantity consumed and the duration of use directly correlate with the escalating negative impact on overall brain function. Moving on, we address medications frequently prescribed for an incredibly common and often uncomfortable digestive problem: proton pump inhibitors, PPIs, for acid reflux. PPIs, encompassing brand names like omeprazole, lansoprazole, and esomeprazole, are among the most widely prescribed medications globally for managing chronic heartburn and debilitating acid reflux. These are truly household names, and millions of seniors conscientiously take them daily, often for years on end, believing them to be entirely benign. These drugs exert their therapeutic effect by effectively shutting down the proton pumps in the stomach responsible for producing stomach acid, thereby providing significant relief from that agonizing burning sensation. Yet, extensive research has tragically uncovered a disturbing and pervasive link between prolonged PPI use and the development of dementia. A comprehensive German study published in the esteemed journal Neurology meticulously analyzed the health records of an expansive cohort of 73,679 participants aged 75 and older, none of whom presented with dementia at the study's inception. Following these individuals for 7 years, the researchers conclusively found that those who regularly used PPIs experienced a substantial 44% increased risk of developing dementia compared to those who did not use these medications. The underlying mechanisms elucidating this connection are both fascinating and frightening. When stomach acid production is significantly reduced for extended periods, the body's crucial ability to absorb vitamin B12 is severely impaired. Vitamin B12 is an essential nutrient, absolutely vital for maintaining the protective myelin coating that insulates nerve cells in the brain, ensuring efficient neural communication. Without adequate B12, these critical nerve cells inevitably deteriorate, leading directly to observable cognitive decline. Furthermore, PPIs have been shown to adversely affect how the body processes a protein known as amyloid. When amyloid is not properly and efficiently cleared from the brain, it accumulates, forming the notorious plaques that constitute the pathological hallmark of Alzheimer's disease. Corroborating this, another study from the University of California, San Diego, strikingly demonstrated that mice administered PPIs exhibited significantly higher levels of amyloid plaques in their brains after a mere 3 months of treatment. Researchers measured an alarming 30% increase in brain amyloid levels in these mice compared to the control group that did not receive the drugs, highlighting the swift potential for damage. Our attention now shifts to medications that provide relief to millions of seniors struggling with bladder control issues. Anticholinergic drugs prescribed for overactive bladder. Overactive bladder syndrome afflicts nearly 30% of the senior population, and the standard go-to medications for this condition are anticholinergics such as oxybutynin, tolterodine, and solifenacin. These drugs primarily function by blocking cholinergic receptors in the bladder muscle, effectively reducing the urgent and frequent need to urinate. However, as previously discussed, the principle of blocking cholinergic receptors in the body extends invariably to the brain, where acetylcholine is unequivocally crucial for optimal memory function and overall cognition. A landmark study emanating from the University of Washington meticulously followed 3,534 seniors for over a decade, diligently tracking every single anticholinergic medication they consumed. The The results, subsequently published in JAMA Internal Medicine, were nothing short of shocking. Participants who regularly took these bladder control medications for a period exceeding 3 years exhibited a staggering 54% higher risk of developing dementia compared to their counterparts who had never used them. The study employed an innovative metric called the Anticholinergic Cognitive Burden Scale to precisely quantify cumulative exposure, and it was determined that taking even just one strong anticholinergic medication daily for 3 years was sufficient to significantly elevate dementia risk. Moreover, sophisticated brain imaging studies unveiled actual, discernible physical changes in the brains of these individuals. Seniors taking these medications displayed measurable shrinkage in their brain's gray matter, particularly within regions critically responsible for memory formation and executive function. The truly frightening aspect is the common practice of many doctors prescribing these medications for long-term use without adequately discussing the profound cognitive risks with their patients. Adding to this concern, research from the University of East Anglia suggests that the cognitive damage incurred might not be entirely reversible. Even after cessation of these medications, some cognitive deficits tragically persisted in study participants, underscoring the potential for permanent harm. Next, we investigate a class of drugs upon which many seniors have become dependent for alleviating anxiety and inducing sleep. Benzodiazepines for anxiety and insomnia. Benzodiazepines, including well-known names such as lorazepam, diazepam, and alprazolam, are routinely prescribed to millions of seniors to manage anxiety disorders, combat insomnia, and alleviate muscle tension. These medications exert their calming effect by enhancing the action of a neurotransmitter called GABA in the brain, which in turn reduces neural activity. However, prolonged long-term use of these drugs has been unequivocally linked to serious and progressive cognitive decline. A comprehensive French study published in the prestigious British Medical Journal tracked 1,096 participants aged 78 and older for an extensive 15-year period, none of whom exhibited dementia at the study's commencement. The researchers conclusively found that those individuals who had taken benzodiazepines for more than 3 months had a substantial 51% increased risk of developing dementia. The risk was even more pronounced for those who consumed long-acting benzodiazepines, which, by virtue of their pharmacokinetic profile, remain active in the system for extended durations. A corroborating Canadian study, which meticulously analyzed health data from 1,196 Alzheimer's patients and matched them with nearly 7,200 controls, yielded remarkably similar results. This analysis revealed that individuals who used benzodiazepines for a period ranging from 3 to 6 months experienced a 32% increased dementia risk, a figure that dramatically escalated to an 84% increased risk for those whose usage extended beyond 6 months. The intricate mechanism behind this cognitive impairment involves how these drugs adversely affect neuroplasticity, which is the brain's remarkable capacity to form new neural connections and adapt to new information. Benzodiazepines essentially impede and slow down this vital process, leading over time to discernible cognitive impairment. Furthermore, they impact the very structure of neurons themselves. Studies employing advanced electron microscopy have startlingly demonstrated that chronic benzodiazepine use leads to deleterious changes in the shape and function of dendritic spines, which are the minuscule protrusions on nerve cells that serve as crucial receiving points for neural signals. Let us now turn our attention to medications that millions take for the pervasive condition of depression: tricyclic antidepressants. Before the advent of newer generations of antidepressants, tricyclic antidepressants, TCAs, such as amitriptyline, nortriptyline, and doxepin were the established standard treatment for depression, and a significant number of seniors continue to take them today, sometimes specifically for depression, but frequently for intractable chronic pain or neuropathic nerve pain. These medications possess potent anticholinergic properties, meaning they profoundly block the action of acetylcholine, much like the bladder control medications we previously discussed. A rigorous study published in the journal Neurology meticulously examined cognitive function in 688 participants with an average age of 74, employing both comprehensive cognitive tests and advanced brain imaging over a 10-year period. The researchers conclusively observed that seniors regularly taking tricyclic antidepressants exhibited significantly accelerated cognitive decline when compared to those taking newer antidepressant medications with fewer anticholinergic effects. Specifically, participants on tricyclic antidepressants scored an average of 4.5 points lower on the Mini-Mental State Examination (MMSE) after 10 years, a clinically significant difference indicative of a tangible decline in cognitive abilities, especially when contrasted with those receiving selective serotonin reuptake inhibitors (SSRIs). Brain scans provided even more concerning revelations. Seniors taking tricyclic antidepressants demonstrated significantly smaller brain volumes, with the most pronounced and alarming shrinkage occurring in the temporal lobe, a region absolutely critical for the intricate processes of memory formation. The study quantified an average volume reduction of 8.3% in this vital region compared to those not taking anticholinergic medications. Another extensive research project from the University of Indiana School of Medicine utilized sophisticated PET scans to measure brain metabolism in seniors using these medications. They uncovered a troubling reduction in glucose metabolism within the brain, a clear indicator that brain cells were not functioning optimally or receiving adequate energy. This reduction in metabolism was found to be most severe in precisely those areas of the brain that are earliest and most significantly affected in the progression of Alzheimer's disease, thereby establishing a disturbing parallel. We now arrive at medications that directly influence critical physiological functions such as heart rhythm and blood pressure, certain blood pressure medications. It is imperative to clarify that not all blood pressure medications impact cognition in the same manner, but specific types have been unequivocally linked to dementia in recent compelling studies. Beta blockers that possess the characteristic of readily crossing into the brain, most notably propranolol and carvedilol, have elicited substantial concern among researchers. These medications function by blocking adrenaline receptors, which subsequently slows the heart rate and effectively lowers blood pressure. However, when these agents traverse the delicate blood-brain barrier, they can directly impinge upon and adversely affect cognitive function. A study originating from the University of California, Irvine, meticulously analyzed data from 774 seniors participating in a long-term aging study. This analysis revealed that participants taking centrally acting beta blockers, those precisely designed to cross into the brain, exhibited greater and more rapid cognitive decline over a 3-year period when compared to those taking beta blockers that do not readily cross the blood-brain barrier. The researchers rigorously measured cognitive function using detailed neuropsychological tests and concluded that centrally acting beta blockers were associated with an average decline of 3.2 points on cognitive screening tests over the study period. While this numerical decline might not immediately appear substantial, within the critical context of dementia progression, it represents a genuinely significant and concerning acceleration of cognitive impairment. What is particularly noteworthy and provides a ray of hope is that not all blood pressure medications exert this detrimental effect. In fact, certain classes of blood pressure drugs, specifically ACE inhibitors and angiotensin receptor blockers, ARBs, have been demonstrated in some studies to actually reduce dementia risk. A comprehensive Johns Hopkins study encompassing over 3,000 seniors found that those taking ACE inhibitors experienced a remarkable 35% less cognitive decline over the study period compared to those taking other types of blood pressure medications, underscoring the critical importance of the specific type of blood pressure medication chosen for overall brain health. Our discourse progresses to medications frequently prescribed following surgical procedures and for the management of chronic pain. Opioid pain medications, opioid analgesics, including powerful compounds such as oxycodone, hydrocodone, and morphine, are prescribed to millions of seniors for the often intense pain management required after surgery, or for debilitating chronic pain conditions. These potent drugs operate by binding to specific opioid receptors located in the brain and spinal cord, thereby effectively blocking the transmission of pain signals. However, burgeoning research increasingly demonstrates that these drugs exert serious and pervasive deleterious effects on cognitive function. A rigorous study published in JAMA Internal Medicine followed 2,000 seniors for an extensive 12-year period and conclusively found that those who regularly used opioids had a substantial 60% higher risk of developing dementia compared to individuals who had never used them. The risk was found to escalate significantly with both the dose of the medication and the duration of its use, with seniors taking high doses of opioids for more than 6 months experiencing the highest risk category. Advanced brain imaging studies have provided crucial insights into how opioids can damage cognitive function. Researchers at the University of California, San Francisco utilized functional MRI, fMRI scans to examine the brains of long-term opioid users. They observed a concerning reduction in gray matter volume within the frontal cortex and temporal regions, which are precisely the areas critical for complex decision-making, memory processing, and emotional regulation. This reduction in gray matter was measurably detectable after a mere 6 months of regular opioid use. Another intricate mechanism involves how opioids adversely affect the production of new neurons, a process known as neurogenesis within the hippocampus. Studies conducted in animal models have graphically shown that chronic opioid exposure can reduce neurogenesis by up to 50%, implying that the brain was generating only half the normal number of new nerve cells it should, a devastating impact on the brain's capacity for learning and memory. Furthermore, the inflammatory effects of opioids on the brain have been meticulously documented. Research indicates that long-term opioid use triggers the activation of specialized immune cells in the brain called microglia, which subsequently release inflammatory chemicals that directly damage neurons, further contributing to cognitive decline. We now approach the second most critically important medication category on our list: anticholinergic antipsychotics. Antipsychotic medications such as quetiapine, olanzapine, and risperidone are sometimes prescribed to seniors not only for severe psychiatric conditions, but, alarmingly, also for managing behavioral symptoms in individuals who have already been diagnosed with dementia. This particular practice is profoundly concerning. These medications possess strong anticholinergic effects and additionally directly impact dopamine levels in the brain, a neurotransmitter crucial for a variety of cognitive functions. A comprehensive study published in the esteemed BMJ rigorously analyzed the health records of 40,170 patients who had already been diagnosed with dementia. The researchers unequivocally found that seniors who were subsequently prescribed antipsychotic medications experienced a significant 60% increased risk of accelerated cognitive decline when compared to those who were not given these drugs. Even more alarmingly, a study conducted in Finland meticulously followed 70,718 individuals newly diagnosed with Alzheimer's disease. This research revealed that those who were prescribed antipsychotics exhibited significantly higher mortality rates, with deaths occurring on average 1.5 years earlier than in those who were not on these medications. The cognitive impact of these drugs is both measurable and rapid. A clinical trial published in The Lancet examined 165 Alzheimer's patients who were randomly assigned to receive either antipsychotics or a placebo. After just 12 months, those taking antipsychotics showed cognitive decline that was 2.5 times faster than the placebo group, with memory tests revealing particularly severe impairment in critical areas of recall and recognition. The intricate mechanism underpinning these effects involves how these drugs profoundly affect multiple neurotransmitter systems simultaneously. They block not only acetylcholine, but also dopamine and serotonin, all of which play absolutely crucial and interconnected roles in optimal cognition. Advanced brain imaging studies have consistently shown that seniors taking these medications experience accelerated brain atrophy, particularly noticeable in the frontal lobes, which are integral for executive function and personality. Finally, we arrive at the number one medication category you absolutely need to be aware of: anticholinergic antidepressants combined with other anticholinergic medications. The single most dangerous and prevalent situation is not merely the consumption of one problematic medication, but rather the treacherous combination of multiple anticholinergic drugs that seniors often take simultaneously, frequently without realizing the devastating cumulative effect these drugs exert. This perilous scenario occurs with alarming frequency because different medical specialists often prescribe various medications without adequately coordinating care or reviewing a patient's entire drug regimen. For example, a senior might be diligently taking an anticholinergic antidepressant prescribed by their psychiatrist, a bladder control medication from their neurologist, and an over-the-counter antihistamine for seasonal allergies, thereby unwittingly receiving a triple dose of compounded anticholinergic effects on their fragile brain. A truly groundbreaking study published in JAMA Internal Medicine meticulously followed 3,346 seniors for over 7 years, diligently tracking every single medication they consumed. The researchers carefully calculated something called the Anticholinergic Cognitive Burden (ACB) score for each participant, a metric designed to quantify the total anticholinergic load. What they ultimately discovered was profoundly shocking. Seniors with a total anticholinergic burden score of 3 or higher, a level easily achievable by taking just 2 or 3 common medications, had a staggering 54% increased risk of developing dementia. But here lies the most critical and alarming aspect that makes this the number one issue. The study unequivocally found that the damage appeared to be permanent. Even after seniors ceased taking these problematic medications, their increased dementia risk tragically remained. The researchers compared brain scans taken before and after medication use and observed that the measurable brain volume loss did not reverse when individuals discontinued the drugs, suggesting enduring structural changes. Another significant research project from the University of East Anglia further examined 58 seniors who had been taking anticholinergic medications for at least 3 months. After the medications were stopped, the researchers continued to assess cognitive function for a period of 6 months. While some modest improvement was observed in attention and processing speed, the pervasive memory deficits regrettably persisted, underscoring the potential for long-lasting, irreversible damage. The frightening reality is that, according to data from the National Health and Nutrition Examination Survey, over 20% of seniors are simultaneously taking multiple anticholinergic medications, and the vast majority of them are completely unaware that their various medications are synergistically working together to inflict profound damage on their precious cognitive function. A study from the University of Michigan further revealed that among seniors taking 5 or more medications, a common scenario for this demographic, 53% were taking at least one drug with strong anticholinergic effects, and a concerning 18% were taking 2 or even more such medications. This critical overview strongly suggests that your personal medication cabinet might be in dire need of a serious and thorough review. The research we have painstakingly covered today is emphatically not fringe science or preliminary, unconfirmed findings. These are large-scale, rigorously peer-reviewed studies published in the most respected and authoritative medical journals in the world. The profound connection between these widely used medications and the terrifying acceleration of dementia is unequivocally real. It is measurably quantifiable, and it is tragically affecting millions of seniors right now. However, and this is of paramount importance, you should never, under any circumstances, cease taking any prescribed medications without first engaging in a comprehensive discussion with your doctor. Many of these drugs address serious medical conditions, and abruptly discontinuing them can pose significant health risks and be genuinely dangerous. Instead, we strongly urge you to proactively schedule an appointment with your physician and engage in an honest, open conversation about your current medication regimen. Ask directly if there are alternative treatments or different drugs within the same class that possess fewer known cognitive side effects. Request a comprehensive medication review where all your prescriptions, including over-the-counter drugs, are meticulously examined together to identify potential adverse interactions and, crucially, to calculate your cumulative anticholinergic burden. Sometimes merely switching to a different drug within the same therapeutic category can yield a huge and positive difference for your long-term brain health and overall well-being. Your mind is an extraordinarily precious asset, and protecting its intricate functions and preserving its vitality should be an absolute priority in every healthcare decision you make. If you have found this information to be valuable and enlightening, please consider subscribing to our channel for more evidence-based health information that could genuinely protect you and your cherished loved ones. We also eagerly invite you to share your personal experiences and considered opinions in the comments section below, as we deeply value and love to hear them.